I'm Dr. Bradshaw with Wilmington Functional Medicine. Today, we're going to go over the instructions on how to handle going over a Doctors Data GI360 stool test. In other words, we're going to play with some poop. It is what it is. So let's get into it. Make sure, number one, first, that the video you're watching corresponds with the test kit you've been given. So make sure it's a blue and white box, and on the end it should say GI360 stool. If it does not, you either have the wrong test kit or the wrong video. Now, our staff is fantastic, but mistakes happen. So let's make sure, number one, that that is correct. We're going to assume that it is. So let's dig in. We're going to open up the box, flip open the lid, and go through the contents. Okay? First thing you're going to see is a test requisition form. We're going to go over that in just a second. I'll have to fill that out. Instruction booklet. The bag, FedEx bag, you're going to ship all of this in. Big envelope, plus a little return address label. All that. Shipping label is going to go over there. We'll deal with that in a moment. Ice pack. Now, when you first received this kit at the office, our staff should have informed you need to go home right away and take this ice pack out, put it in the freezer. If you have not, do it now. This is very important. This needs to be frozen, so go throw it in your freezer. And then we're going to have some French fry looking trays and some baggies. 3 baggies. Don't throw this box away, by the way. You will need it to mail your entire package, so just put it off to the side. You're going to have, actually 4 baggies, excuse me. You got a baggie labeled day 1, says it right here. Day 2, right here. And then 2 bags labeled day 3. You can see it right here. So, this is a multi-day stool test. It needs to be done over a 7-day period total. So you don't have to do these on back-to-back days, 3 days, boom, knock it out. But if you start on a Monday, you have till the following Sunday night before you need to be done. So if you do it on a Monday and a Wednesday and a Friday, perfect. Okay, you have 3 of these French fry trays as well. Each day that you poop, you're going to collect the poop in here. So that's what these are for. We'll go over that a little bit later. Let's dig into this requisition form. Pretty simple. It's only front-sided. The back side's already scratched out for you, so don't worry about that. The part that's highlighted is the part you need to fill out. It's just basic patient information. Okay? So make sure that it gets done. This will go with your sample to the lab. So we're going to put that aside. That's easy. Let's get our instruction manual out so we can go through this. Because there are some things you're going to have to discontinue or avoid prior to this test. And let's just go through those, okay? So 2 weeks before your test, the following things you cannot take: antibiotics or probiotics. None. Antiparasitics or antifungals. So if you're treating a parasite or a fungus with a medication, none. Any sort of proton pump inhibitors, known as PPIs. So if you have heartburn, pretty bad gastric acid or reflux, you're going to want to get off of those PPIs for a full 2 weeks, that medication, for 2 weeks prior to you doing this test, all right? It's very important. And you take bismuth as well. Can't do that. Now, get a little closer to testing time, 48 hours or 2 days before your stool sampling, you cannot take the following: no aspirin or ibuprofen, no digestive enzymes or betaine hydrochloride. Those are things to help you digest your food. Can't do it. Laxatives, particularly mineral oil or castor oil, can't do that. Can't do any sort of enemas or suppositories. Can't do that. Activated charcoal or bentonite clay, can't do that either. So if you're doing any of those 5 things, and those are all listed here on this middle page, so if you didn't write that all down, it's all here. But you can't do that 2 days before your test, okay? As well, we can't have any blood in the stool. So if you're menstruating, a woman at that time, you gotta stop and just hold off on this test until you're done, so we don't get any blood in the stool. And the same thing for people with hemorrhoids. If you've got active bleeding hemorrhoids, that blood in the stool will screw up the test. So you're gonna have to wait till those heal up and your stools are blood-free. Then we can go ahead and do the test, all right? If you've had a colonoscopy or a barium enema, you need to wait a full month, 4 weeks before doing this test. So if that's you, hold off. We'll give it a full month. You do not want to contaminate the stool with urine or water. So when you're pooping into the French fry tray, it's dry. We don't want to dip this into the water to get the poop out or anything. You just have to poop directly into this dry tray. It needs to remain dry, okay? Ideally, before you collect your stool, it's best to void the urine, get all your pee out first, then poop afterwards. That really helps kind of avoid that keep that from happening, okay? Avoiding that problem. They do say down here that sometimes doctors recommend you do, maybe just do the poop on 2 different days or 1 day. No. If you have this kit from us, we're going to want you to do it over 3 days. So you're going to collect your samples on 3 different days. So don't worry about that part down here. Just know that's how you're going to do it. Okay? So let's actually dig into the bags here a little bit. Let's go to day 1 and see what that looks like. So we've got a baggie. Got a vial in there with a black cap, okay? We got a little wipe to help you with the mess. It's nice of them. Should be a little bigger, I think. And they got a glove. And don't throw away this baggie it comes in. It's a specimen bag. It's important that you put the vial back in here when you're done. But anyway, you got a glove, so you can use that to keep your hand clean. So on day 1 of the stool sample, you're going to poop into this tray. And yeah, it's very possible that your poop will not completely fit in this tray. Just have some towels nearby. Be ready for some mess. Speaking of this personal experience, when I first did this, my poop was over the edge of the tray. It was a mess. Just beware. Be forewarned, okay? But anyway, you're going to take that. Poop is in there. Get your glove on. You're going to open this up. Unscrew the cap. And at the end of that, you're going to see attached is a little spoon/fork, like a little Taco Bell spork. That's what you're going to use to scoop the poop out, okay? So I recommend, because you're going to end up filling this vial from where the fluid is. I think you can probably see that, where the fluid is, up to that black line right there. So you're going to put in about that much poop into this small vial. So not a whole lot. But we are going to try and collect poop from different spots within your sample. So you're going to dig in on one side, kind of scoop in there, put it in there, then go to the middle of the poop, dig a little bit, put that in there, then go to the other end of the poop, scoop a little bit out, put that in there. You want to get it up to that black line, but not over. So don't scoop out a whole bunch all at once, one end. You want to try to get a sample from different spots, a little bit at a time. Once you get the poop in there, you're going to get up to that black line. The fluid plus the poop gets right to that black line. You're done. Do not overfill. Overfilling will screw up the results, screw up your test, and you'll have to do it all over again. So do not go above the fill line. Each of these vials will have the exact same fill line. Do not go above that, okay? Once that is complete, on the side of the vial you can see there are 3 lines. You're going to write, make sure we're correct on this, you're going to write your full name, date of birth, and the date of collection of the specimen. So if it's July 4th, you're going to write July 4th on there, and the year as well. So that way they've got that on there. Now, the black vials go back into the specimen bag, and then that specimen bag goes into the refrigerator. Okay, we're going to keep that cool, not frozen, but cool, while we wait to do day 2 and day 3. All right? So we put that aside. We're going to pretend that's in the fridge. Okay? Take the poop that's in the tray, into the toilet, throw this away, throw your glove away, throw the wipe away. Okay? All done. On to day 2. And as I said before, it does not have to be a consecutive day. It just needs to be somewhere in the next couple of days. So we pick out day 2, exactly like day 1. Literally, the contents are the exact same. You got a vial with a black cap, you got a wipe, you got a glove. All right? Take your second French fry tray here. Same thing. Poop, scoop, up to the fill line, write your name. When you're done to the fill line, cap it off, write your name, date of collection, your date of birth on the side here, right here. It's very important. Put that back in the specimen bag on day 2. Oh, I almost forgot. A very important part. We want the poop not to sit on top of that fluid. We want the poop to get all mixed in with that reagent, that liquid that's in there. So once you get the poop in there and the cap on tight, and you write your name on there, you're going to take it, you're going to invert it like this. You're going to shake it up for about 30 seconds, back and forth. Just get that poop all mixed up in there, okay? That's important. You want to make sure we get a nice, good, kind of smushy sample in there. It's gross, but nonetheless, that helps the lab determine and get the results of what's going on here the best. So, day 1, day 2, and again, day 2 goes into the plastic bag, close it up, into the fridge it goes. Again, throw your extra poop away, glove, wipe, tray, trash. Now on to day 3. Day 3 is a little different. 2 different bags. 2 different bags. One of them has 1 vial, one of them has 2 vials. So all told, with this test, there are 5 vials that are going to have poop in them. Okay? So make sure you're clear on that. Let's do this one that has the 2 vials in it first. Like the other days, there was a black vial, black cap vial, but this one has a yellow cap vial. Okay? So there's 2 in that bag. Again, there's a wipe, there's a glove. Keep the specimen bag aside, we're going to need it again. Okay? Alright, so now, same thing. And by the way, we're on day 3. So if you do them on consecutive days, it's not a problem. Just know that you should have been on this day 3 test no less than 1 week after that first day 1 sample. Okay? So we're 4 days later, 5 days later, it's fine. Here we are. Day of reckoning. Poop into the French fry tray. Open up your black vial. Same thing. You're going to have that spork in there. Go in there, scoop out, put it in there, get enough poop in there to the fill line like we spoke about earlier. Once you're there, write your name, date of birth, date of collection on there, and then back and forth, right? 30 seconds, get it all mixed up. You're going to do the exact same thing with the yellow one. The yellow one, you're going to open it up. It's got a spork. You're going to take, it's just got a different fluid in it, all right? So you're going to get a little different color. But you're going to scoop enough poop into, scoop it from one end, scoop from the middle, scoop from the other end, but get enough poop to fill it up. Again, you can see where that red line is. You can see it even better on this vial. From there to that red line, that's it. You got about that much poop you're going to add in there. Once you're done, name, date of birth, date of collection. Mix it. 30 seconds, back and forth. Okay? Once 30 seconds is up, take both of those vials back into the day 3 specimen bag and close it up. Into the fridge it goes. Okay? We're still on day 3. We're going to get out the white tube now. This is day 3. It says it right here as well. The other bag said day 3, so does this. This one has a white tube in it. So keep that poop that you used. We're going to put some poop in this one too. You got another extra wipe in there. You're going to open this up. This one also has a spork, but there's just a little bit of powder down in there. Just a little bit, okay? This one has no other liquid in it though. So you need to put a lot more poop to get from the bottom up to that fill line. All right, instead of putting this much poop, you're going to be putting in about that much poop. All right? The same rules apply. You're going to scoop it, one end, put it in. Middle, put it in. The other end, put it in. And keep doing that. End, middle, end, until you fill the bottle up to that fill line. Once you get to that fill line, put the cap back on nice and tight. You're going to write your name, date of birth, date of collection, okay? But this one you're not going to shake. You don't need to do this upside down thing. Just leave it, okay? You're going to put it, though, directly into the freezer. So go in, put it back in your bag, just like the other ones have to go in their bag. This one has its own bag. There is a little sleeve in the back of this bag. You can't really see it, but you'll see when I take the freezer, the ice pack. So this has been frozen for a while. We talked about this in the beginning. This needs to be frozen. You're gonna slide it into the back of this, just like that. So now the ice pack is actually kind of attached to your specimen. Put this whole thing with the pack on top of it, the bottle on the bottom, right in the freezer on your shelf. You're gonna need to let that freeze for about 6 hours, okay, minimum. You can go longer, but we don't wanna let all this sit around for too long, okay? We need to get this over to the lab so we can get it analyzed, we get the results back, and we can go over it with you as soon as possible. So you're gonna wanna ship this on a Monday through a Friday, okay? Let me go ahead and just show you how it's going to be set up in the box before we talk about that. But just know that this needs to freeze for 6 hours minimum. Once that's frozen, then we can take the refrigerated stuff and the frozen stuff and we can ship it off. Right? So give it a good 6 hours. Take this, obviously the poop you had in the French fry tray, throw that away. Your wipes, your glove, boom, we're done with all that stuff. The only thing you're really going to have left when we're all said and done is your instruction manual right here. So we go to the fridge and the freezer. We take out our bags, day 1, day 2, day 3 that have been refrigerated. Those are going to go in there. We're going to take out our specimen, day 3 that was frozen. We're going to put that in there. We're going to put that all in the box. We're going to go back to our requisition form. Remember that thing we filled out in the beginning? Highlighted area right there. We're going to put that in the box. And, oh yeah, and you need to mention on here when the date of the final sample was done. So you don't want to write your, it's right under here where it says GI360 stool. It says date when the final sample was collected. You want to make sure that you put that on there. So if it's, July 7th was the last day, write that on there. And then below that, it says check to confirm the specimens were stored according to instructions. So the date that the specimen is shipped, you're going to write that right there. Okay? So that's it. So if you collect it on July 7th, you ship it on July 8th, put that July 7th and then July 8th. Write that in there. That's the only other thing you have to do. That whole requisition form goes on top. Close this up. Sides, top, tongue, right there in the front, goes in last. I'm going to recommend, because that tongue is a little loosey-goosey, I put a piece of tape on there just to hold that closed. You don't want that opening up inside this bag. Take the box, slide it into the bag, open that bad boy up, slide it in. Now, there's a little adhesive sleeve, a clear one right here. Going to peel that off. Get those two to stick together. Once you've done that, you can see it says right here, biological substance category B on here. We're not going to drop this off at a typical FedEx drop-off center. This needs to go overnight. It needs to be special pickup. So before we talk about how that works, I want you to take your shipment label and you're going to write right here in this box, this upper box, it says from. You're going to write your name, your address, and then right over here, just to the right of that, write your phone number on there. Just in case something happens, they need to call you, they can do that. Okay? Everything below that, down here, you're going to leave it alone. Even this where it says release signature, don't mess with any of that. That'll just screw it up. Just put your return address and your phone number right here. Okay? You're going to take that big label. You're going to peel it off. And right in the middle of this package, you see this big square bullseye? Boom. You're going to slap it right on there. So it looks just like that. Okay? Make sure it's all adhesed. Keep the liner for your records. So when you peel this off, you'll see a little number for your tracking, just in case it gets lost or they need to be tracked. You've got that for yourself. I would put that with your instruction manual that you still have. Just kind of paperclip those together, just in case. All right. We're not quite done. We got the package. You're not allowed to drop it off. You need to have FedEx come pick it up. Okay. So on the back, it has a schedule a pickup instruction right here on the back page. It says shipping. So you want to make sure that you call this number, this 800 number, and at the greeting, it'll say schedule at the pickup. That's what you're going to say. I'm sorry. You say schedule a pickup. And when prompted, you're going to say schedule a pickup using a label or stamp. Then, when asked if the word stamp is written on the waybill, you respond yes. So there's three things. You say schedule a pickup, then you say schedule a pickup using a label or stamp, and then when they say is a word stamp written on the waybill, you say yes. Those instructions are right here, so if you get a little confused, just read it, and we'll walk you through it, okay? They're going to ask you for your address and your information. You're going to give it to them so they can come pick it up from wherever you are, be it home, work, what have you. Okay? Do not use a FedEx Dropbox. You're not allowed to. They won't let you. In fact, they'll just sit there. They'll be like, what are we supposed to do with this? We can't. It needs to come from you, your house directly based on this classification of envelope. So that's important. Okay? That's it. They pick it up. It goes off to the lab. Takes 2 to 3 weeks to get the results back. A month at the very latest. But as soon as we get those results, we can go over them with you, get you a game plan, finally figure out what's going on, get you feeling better. So I hope that was fun, playing with poop, and we look forward to helping you.